Okay. Yes, next. Okay, I'm ready.
All right. So if you've read and understood, considering it communication skill station, please begin.
Okay. Hello, good morning.
Good morning.
My name is Dr. Alam Al-Huda, ST1, working for Mr. Man in the city hospital, calling to speak to Mrs. Sambreen, cardiothoracic consultant in the Royal Hospital to refer a patient uh, after RTA with the widened mediastinum. Can I confirm that I'm speaking to Mrs. Sambreen, cardiothoracic surgeon consultant?
Yes, you are. Summarize your patient, please.
Yes, I have 23 years old male patient who is known case of diabetes involved in the motorcycle RTA. He is vitally GCS for 14 out of 15. He is tachypneic with heart rate of tachycardic with a heart rate of 120, hypotensive with blood pressure of 100 over 80, temperature is 37. The patient on examination has a swollen left side. We do investigation for this patient. We found that there is a widened mediastinum in the chest X-ray, and there is bilateral pneumothorax. We insert the chest drain, which is drain 20 cc of blood. But we don't do the CT scan because unfortunately it's not available right now. And we do abdominal X-ray, which found there is absence of pseudo of the psoas shadow. And we do X-ray for the femur, which reveals there is a fracture shaft of femur. The investigation of the patient, hemoglobin is 8, pH 7.32, and carbon dioxide is 6, bicarbonate is 19. And we think the patient have traumatic aortic dissection. We give the patient 4 liters of crystalloid, and we cross-match in 6 units of blood to be standby. And we need to refer this patient for you for your specialty care and for definitive care.
Okay, doctor. What will you do for the cervical spine?
Okay, I will support the cervical spine by the triple immobilization, by the putting hard collar and sandbags and tape as well.
Okay. Do you think this patient is in shock?
Yes, because the patient is hypotensive and tachycardic, so I think the patient has hemorrhagic shock.
Okay. What type of shock do you think this patient has?
Other than hemorrhagic shock could be obstructive shock because of cardiac tamponade, or it could be due to cardiogenic shock. from contusion of the cardiac muscles.
So you made mention of the leg. Well, what will you do for the leg?
Yes, as he has a fracture shaft of femur, so I will immobilize the fracture by the Thomas splint.
Okay. What will you do for the blood pressure?
Okay, and I'm already start the fluid resuscitation. I give the patient 4 liters of crystalloid and cross-matching 6 units of blood if he's not respond. If he is not respond, but I will resuscitate the patient. I will not raise the blood pressure. The systolic blood pressure should be less than 100 millimercury for fear of hemorrhagic shock, which is called the Plancet resuscitation.
Okay. Do you think the patient has metabolic acidosis?
Yes, I think the patient have metabolic acidosis because he has fracture shaft of femur. So there is um, could be there is a compartment syndrome, or it could be there is a hemorrhagic shock, or the patient is diabetic. Could be diabetic kidney.
Okay. You said you couldn't do the CT scan. So what other investigations would you love to do?
Other than CT scan.
Yes.
I do the chest X-ray, which is found is a widened mediastinum and bilateral balloon refusion, and also I do the abdominal X-ray, which reveals there is absence of the psoas shadow, indicating there is retroperitoneal hemorrhage collection, and there is also dilated small bowel loops, and I do the just the left femur X-ray, which reveals there is a shaft fracture.
Okay. Which other investigation would you like to do?
Which investigation I what?
Which other investigation would you like to do apart from the ones you just mentioned?
Okay. I would like to do the ECG and echocardiography.
Okay. Okay. So, apart from metabolic acidosis, what other blood abnormalities did you notice?
I noticed that patient has anemic because hemoglobin is 8, and they also metabolic acidosis because the pH is 7.32, and there is decreased bicarbonate. So I think the patient have metabolic acidosis as well.
Okay, doctor, if you're to transfer this patient to me, who will accompany the case?
Okay, I will come with the patient with the anesthesiologist or anesthesia registrar because if the patient collapse, we will intubate this patient.
So why do you want to refer this patient? Patient has a fracture in the leg. Why do you want to refer the patient to me?
Yes, because the chest X-ray reveals there is a widened mediastinum. So I think the patient had traumatic aortic disruption or injury. So we need to transfer this patient for you for your definitive care.
Okay, you made mention of rupture and dissection. What are the differential diagnosis?
It could be cardiac tamponade, or it could be
Okay.
due to rupture of aortic descending aorta, thoracic aorta, or it could be due to aortic dissection.
Okay, what will you prepare in the ambulance during the transfer of this patient?
Okay, I will prepare the oxygen, source of oxygen, and the IV fluids and blood transfusion, and also I will prepare the CPR set and additional chest tube for if the old one is blocked.
So if the patient needs an intubation, who will do it?
The anesthesiologist who will do the intubation.
Okay, so you made mention that the patient might be in shock. So what are the sources of bleeding in this patient?
Okay, as I told you that patient have fracture shaft of femur, so the source of bleeding could be in the thigh, or I said that in the abdominal X-ray there is absence of psoas shadow. It could be due to bleeding or hemorrhage in the retroperitoneum, or it could be due to the aortic dissection, rupture in the aortic dissection.
Okay, but doctor, you said the chest tube drains just 200 mils.
Yes,
So if there is a major injury in the chest, why is it just 200 mils?
because the chest tube is inserted in the pleural cavity and the rupture aortic dissection in the mediastinum.
Okay, so say for instance is an aortic injury, what is the definitive management?
The definitive management would be could be either to be open or endovascular repair.
Okay, so if the widened mediastinum is due to a cardiac tamponade, what would be your treatment?
If the what? I'm sorry, I'm not hearing well.
If the widened mediastinum is due to cardiac tamponade, what would be your treatment?
Okay, I will do the urgent thoracostomy. If it is not available, I will do precardiosynthesis.
Okay, you can transfer the patient.
And
Okay,
how are
so
you going to take care of the abdominal issue of the patient?
the dominant issue of the patient, which is the bleeding.
Yes, how are you? Don't you think you should be managing that first before transferring the patient to us?
Yes, we already insert the lines and start the fluid resuscitation, and we cross-match 6 units of blood. So if the patient is not responding to the fluid resuscitation, we will start the blood transfusion.
No. Mm, a patient needs exploratory laparotomy, but that can be done later.
Patient need what?
Exploratory laparotomy.
Okay. Yes, because the patient have retroperitoneal collection, so it could be need for the exploratory laparotomy as well. Yes.
Yes. Okay, thank you.